My name is Andrea Delicio, and I will be talking today about healthcare information systems. Here's an agenda of what I will be going through. First, I will give you a general definition, then the different types of healthcare information systems, history on the systems, what the future looks like, some security and ethical issues, and then I will give you some questions for further discussion. So here's a simple, straightforward definition. Healthcare information systems capture, store, manage, or transmit information related to the health of individuals or the activities of an organization that work within the health sector. There are 4 types of healthcare information systems. The first is operational systems, which are used for easy classification of information. The second are clinical systems, which are used for managing patient details on an administrative level. And as you remember, we learned more about these last week. The third is subject or task-based systems. An example of these are EMRs, which are electronic medical records, which we learned about in our last module. And the fourth are financial systems, which are used for tracking revenue and managing billing submissions. All of these systems are designed to assist healthcare providers with managing daily tasks and patient information. Often, these types of systems are broken up into different software solutions. Next is some history on healthcare information systems. In 1928, the American College of Surgeons took steps to standardize a growing number of medical records by establishing the American Association of Record Librarians, which is known today as the American Health Information Management Association. Record librarians was the term used because early medical records were documented on paper. Standardization of medical records and growth of complete record keeping continued from the 1920s through the 1960s, but records were paper-based during this time. In the 1960s, we saw the emergence of large mainframes. The development of computers presented the opportunity to maintain records electronically, but the expense of purchasing and maintaining a mainframe and the expense associated with storage of data meant that only the largest organizations could use technology to handle medical records. In the 1970s, we saw the emergence of smaller computers. As computers became smaller, software designed to support clinical functions for pharmacy, clinical laboratory, patient registration, and billing began to grow. The disadvantage of these health information systems was their department-specific functions. They were not accessible by other departments. In the 1980s, we saw multiple system integration. Healthcare drivers were heavily tied to DRGs and reimbursement. DRGs is diagnosis-related groups. For the first time, hospitals needed to pull significant information from both clinical and financial systems in order to be reimbursed. At the same time, personal computers, non-traditional software applications, and networking solutions entered the market. As a result, hospitals began integrating applications so financial and clinical systems could talk to each other in a limited way. In the 1980s, we saw increased competition, which resulted in some consolidation. Competition and consolidation drove healthcare, along with the need to integrate hospitals, providers, and managed care. From an IT perspective, hospitals now had access to broad, distributed computing systems and robust networks. This created integrated delivery network-like integration, including the need to integrate data and reporting. In the 2000s, EHRs were introduced. The importance of integrated electronic health records to enable providers to make better decisions grew, and more hospitals and physicians implemented them to reduce the incidence of medical error by improving the accuracy and clarity of medical records. As of 2015, 96% of hospitals and 87% of office-based physician practices were using electronic health records. And in today's current decade, we are seeing data overload. New delivery models such as accountable care organizations, or ACOs, have been implemented to contain costs, promote collaboration, and improve patient health care. While ACOs and growing health systems networks have EHR and other systems to collect data, there is still a gap in aggregating and harmonizing the information from various systems to produce data that can be easily analyzed. Next, I will talk about the future state of healthcare. The first thing is data overload, which we have seen throughout this decade and will continue to see in the future. Growing health system networks have EHR and other systems to collect data, but there is still this gap in aggregating the information from various systems to produce data that can be easily analyzed. Health systems must support the ability to drill down into comprehensive, merged data to achieve real insight into operational performance. This requires complex analysis on queries against millions of rows of data which cannot be performed on transaction system databases without adversely affecting performance. Separate data warehouses are typically required. The second thing for the future is value-based care. There will be an increased focus on value-based care as opposed to fee-based care, and a drive to improve patient outcomes to propel the growing accumulation of data to support clinical as well as operational decisions in healthcare. Just as clinics in the 1920s understood the importance of previous health records as learning tools that would improve outcomes, healthcare professionals leveraged to enhance care on a larger scale, using tools that analyze population health data. The third thing for the future is an emphasis on clinical and financial systems. Health information management is critical in healthcare today. To see how effective management of patient data in clinical and financial systems can help organizations improve patient care and safety as well as operational processes. The fourth thing for the future is EHR 2.0. In a 2014 Medscape's EHR report, the biggest concern expressed about EHRs was that they can decrease face-to-face time with doctors and patients. The concern is driving a great deal of innovation. Physicians should find EHRs much more second nature in the future. Some enhancements that we could see with EHR 2.0 is the ability for them to adjust automatically to physicians' unique habits. There will be speech recognition included, creating a common codified vocabulary instead of the several major medical vocabularies today, and cross-format documentation. As we learned most recently in our last module, the fifth thing for the future is telemedicine and the emergence of it in reality today, and we should see this continue to grow. Next are some security and ethical issues. As we have learned throughout this course, more specifically in the last module and a couple of other presentations, HIPAA is a big security issue in all of healthcare. HIPAA stands for Health Insurance Portability and Accountability Act, and it's legislation that provides data privacy and security provisions for safeguarding medical information. The second security issue are data breaches. We've seen a surge of data breaches across all industries in the last few years. Two of the largest data breaches that have hit healthcare hard included a September of 2009 breach for TRICARE, which 4.9 million people were affected. And the largest data breach so far in healthcare was when Anthem was hacked in January of 2015 and 78.8 million people were affected. You can see in the top right corner there's a chart I found from a few years ago, and it shows the breakdown of different HIPAA violations based on different categories. And you can see that over 50% of the time a data breach for HIPAA violations is due to theft. Almost 20% of the time it is due to somebody in the healthcare field accessing your information without authorization. And then there are lower percentages for loss, a combination of a few things, hacking, improper disposal of your information, and almost 2% can't be defined specifically. Here are a few questions to further discussion on this topic. Are there any solutions you see to help with the data overload from healthcare information systems? Number 2, is data overload an issue in other industries that you can think of? And number 3, are there any issues that you see personally or in the news with healthcare information systems that should be solved in the future that maybe I haven't touched on in this presentation? And here is a slide listing my references. Thank you.